Every cigarette is doing you damage. Lungs are like sponges with millions of tiny air sacs for transferring oxygen. Every breath of tobacco smoke attacks them. No wonder smokers feel short of breath. Their lungs are rotting. Every cigarette is doing you damage.
Authorised by the Australian Government, Canberra.
So you've just finished a nice meal with friends, enjoyed a couple glasses of good wine, and now it's time for that cigarette. Will you light up, inhale your first drag? It tastes good, it feels even better. But do you really have any idea what happens to your body when you smoke a cigarette? The smoke fills the tubes in your lungs, or the bronchi, with lots of chemicals and soot. It coats these bronchi, leaving behind a poisonous black gooey tar after you breathe out. After a while, your lungs become stained, going from a nice healthy pink to a dirty brown. The cilia, the little hairs inside the bronchial tubes, which usually act like tiny brooms to sweep out harmful dirt and bacteria, get so coated with tar that they can't do their work because the nicotine and other chemicals in the smoke paralyze them. The black gooey tar also coats the tiny air balloons in the lungs, called the alveoli, making it difficult for oxygen molecules to pass freely into the red blood cells. So we showed you what happens to your body when you start smoking. Well, here's what happens when you decide to put down that cigarette for good. Within 20 minutes, your blood pressure and pulse return to normal, and your body temperature improves. After 24 hours, the chance of a heart attack decreases. After 48 hours, the ability to smell and taste improves as nerve endings start to regrow. After 72 hours, lung capacity increases, and after 2 to 4 weeks, circulation improves. After 1 to 9 months, the protective cilia in the lungs regrow, significantly decreasing your risk for pneumonia and bronchitis. After 2 to 5 years, the risk of heart attack is the same as for a non-smoker. And after 5 to 10 years, the risk of cancer is only 1/10 that of a smoker's. Now, if you do decide to pick up that cigarette, from your first puff to your last, you know what happens next.
Sometimes you can hear lung cancer in smokers before you see it. There's a whistling noise. It's the air racing around the lung cancer, almost completely blocking an airway. By the time most lung cancers are discovered, it's already too late to operate.
Authorised by the New South Wales Government, Sydney.